So I'm going to show you some joint mobilizations of the glenohumeral joint. And for purposes of this video, I'm just going to do a grade 2 joint mob, so basically taking up the slack of the joint. But for your purposes, you can do this anywhere from grades 1 through 4 in these positions. So first thing I'm going to show you is a distraction of the joint. So I'm going to get my inside hand that's closest to the client up as high as I can without being intrusive into near the axilla. Then I'm going to come and bring the arm down into about 30 degrees of abduction, which is the open pack position for the joint. I'm going to take my outside hand and I'm going to hold it down closer to the elbow joint. And I'm going to then apply a pressure laterally with my inside hand and a pressure medially with my outside hand. And what that's going to do is it's going to provide a little bit of distraction. So basically the head of the humerus is going to be distracted from the glenohumeral joint there. And with grade 2, I'm just going to take up that slack. If I wanted to do a grade 1, honestly, all you have to do is hold it in this position, and that basically becomes a grade 1. And then with a little bit of effort and leverage, that becomes a grade 2 distraction. The next thing I'm going to do is a posterior glide. So I'm bringing the humerus out, the arm out into about 30 to 40 degrees of abduction. So that's open pack position. I'm going to get the client to rest her hand against my arm here. And I'm going to hold with my inside hand, I'm going to hold cup underneath the inferior part of the humerus, so right near the elbow joint. And with my outside hand, the one that's farthest from the client, I'm going to put my thenar eminence here against the head of the humerus from the anterior side. Now I want to make sure before I do this that I'm finding the acromion process, because pushing on the acromion process is counterproductive. I want to be lateral to that acromion process. So right here, sort of on the edge of the humeral head. I'm going to take my thenar eminence and I'm going to press towards the table, so posteriorly, and that is going to be my grade 2 posterior glide. Now, if I have a client with a larger arm, or if I just want to make things a bit easier on myself, I'm actually going to take this bottom hand that's holding underneath the elbow, and I'm going to pull it anteriorly at the same time as I press posteriorly with this hand. So again, I'm giving some leverage so that this push-pull makes it a lot easier for me to take up the slack from that joint and do a grade 2 posterior glide. Now I'm going to do an inferior glide. So I'm going to cup underneath just near the elbow joint with my inside hand, the one closest to the client. I'm going to have her arm just resting against my arm so that she's nice and relaxed and I have an ease of movement here. And then with my outside hand, I'm going to come to the top of the shoulder, making a C shape. And again, I'm going to find that acromion and make sure that I'm not pressing down upon the acromion, counterproductive. I want to be lateral to the acromion, pressing down on the most superior part of the humerus here. So as I'm pushing down, that right there is going to be a grade 2 inferior glide. If I want to use a leverage option, I'm going to take this lower hand and I'm going to abduct the humerus, the shoulder, further as I glide inferiorly to give myself some leverage. Just like that. That's the inferior glide. For the anterior glide, we can do this from a position with the client in supine or prone. I prefer prone, but there are some reasons why you can be successful in doing it from a supine position. So I'll get my client just to move in a little bit so she's on the table. Perfect. So I'll have her arm resting on her, and I'm going to take my inside hand and I'm going to depress the clavicle just a little bit and also press it slightly posteriorly. Okay, so I'm just basically fixing that clavicle with my inside hand. With my outside hand, I'm going to scoop underneath to find the posterior aspect of the head of the humerus. Not pushing on the scapula here, I'm coming lateral. It's almost as though I'm grabbing the deltoid but the intention here is on the bone. Okay, so this hand here on top depresses the clavicle and presses it slightly posteriorly as the bottom hand here pulls anteriorly. And so with that, we get an anterior glide of the humerus, grade 2. Now for the anterior glide in a prone position, I'm going to have my inside hand closest to the client scoop underneath the arm near to the elbow crease. Okay, so I'm just cupping, I'm almost cupping her bicep. And with this, I have a lot of control over the humerus in which direction it is. I'm going to make sure that we're in an open pack position, again, about 30 degrees of abduction. And then I'm going to take the thenar eminence and I'm going to come to the posterior side of where the head of the humerus is. Again, I'm not going on that scapula. That's counterproductive. I want to be on the humerus only. It's almost as though I'm grabbing the deltoid muscle to do this, but the intention is the bone. So I'm going to lean in and in an anterior direction, press the head of the humerus anteriorly. If I would like, at the same time, I can pull upwards on this inside hand, giving myself a bit of leverage again. So a push with the thenar eminence, a pull with the inside hand, and there you have a bit of an easier grade 2 anterior mob.